So endoscopy is a type of minimally invasive diagnostic procedure by which we insert a small tube that has a camera at the end of it, either through the mouth to visualize the oral cavity, throat, the esophagus, the food pipe, the stomach, etc., or to visualize the colon, rectum. We insert the tube through the rectum. So most commonly endoscopy, it is synonymous with upper GScopy, that is the tube is inserted through the mouth. So how we prepare the patient is, ideally the patient should always be on fasting from the previous day midnight, because if there is food in the stomach, the visualization is difficult. We cannot clearly see. So after that, in the morning, the patient is shifted to the endoscopy room. So generally, it is an OPD or a daycare procedure. Admission is usually not required unless there is some other contraindication or some comorbidities or any other reasons. Otherwise, generally, it is done on daycare basis. So before the procedure, the oral cavity will be sprayed and the throat will be sprayed with a local anesthetic spray to numb the area. And then a small tube with the camera will be passed. So why this is done is we'll be able to visualize the entire throat, behind the throat, the food pipe, the stomach, if there is any lesion, if there is any block. So everything can be visualized, and we'll also know from the mouth at what centimeter it is, how long it is, everything we will come to know. So it is generally a painless procedure. You may experience some throat discomfort, but generally goes away in 1 to 2 hours. Another advantage of endoscopy is, along with the camera, there is an additional port, additional way through which a biopsy forceps or a biopsy apparatus can be inserted. So the advantages of that is, suppose when you're doing a biopsy, we see a lesion, you can directly take a biopsy at the same time, because tumors of the stomach, esophagus, they are deep seated, so we cannot directly take a biopsy from outside. So endoscopy plus biopsy is a most commonly done procedure. So it is a very safe procedure. It is done on an OP or a daycare basis in every centers. It is also done after your treatment to see on a follow-up basis. So every year it is done in some patients. So that is all about endoscopy or upper GA scopy in particular.